I'm going to be your nurse today. Can you just start by verifying your name and date of birth for me?
Sure. George Sugranis. My birthday is January 1st, 1971.
Great, Mr. Sugranis. Is there a name that you prefer to go by?
Georgie's fine.
Georgie. Okay. Well, Georgie, what brings you in today?
Just a regular physical.
Okay, great. Do you have any concerns that you need to tell me about?
No.
Okay, and would you just mind verifying the date today for me?
I think it's April 11th,
Great.
2018.
Okay, so for your physical, I'm just going to start at your head and work my way all the way down to your toes. All right, and let me know if you have any questions or any pain or anything like that as I go, all right?
Okay.
So just look down at your lap. I'm just going to inspect your scalp. Your scalp is clean, dry, and intact. No lesion or areas of redness, and hair is dry as well. So you can look back up at me, and I'm going to feel on your ears. Tell me if you have any pain or tenderness. No?
Mm-mm.
And so I'm just going to inspect here. They look good. No drainage, no redness, no lesions. All right. So then moving on, I'm just going to have a look in your mouth, okay? So if you just open and say ah. Tonsils look good. Mucosa is moist, pink, and intact. No visible dental caries. And just stick your tongue out for me. All right, no problems with that. Bilaterally looks good. I'm going to move on to your eyes. So just look right at me. I'm going to shine this light in your eyes for a few seconds, okay? Oh, my light is dying, so that's good too. All right. All right, both your pupils are round. They're equal. They're reactive to light and accommodating. And I would say that they're each about 4 and they constrict to about a 3. So if you don't mind, just watch my light as I move it. Keep your head still and track it with your eyes only, okay? Great. Okay, so now I'm just going to feel your tonsils again. Let me know if there's any tenderness or pain, okay? I'm going to start at your occipital. I'm going to work your way to post-auricular, pre-auricular, parotid, tonsillar, submandibular, submental, post-cervical, anterior cervical and posterior cervical, and your supraclavicular. All right, none of them were easily palpable to me, so that's good. Seems healthy. No
Great.
problems with that?
Nope, I was all set.
All right, good. Give me a good shrug with your shoulders. Great. So moving down to your arms, any pain, numbness, or tingling when I do that?
Nope.
All right, just hold your hands out for me. Your capillary refill is less than 3 seconds. That's great. Your skin to me looks clean, dry, intact, no lesions or redness. Color appropriate for ethnicity. Just flip your hands over for me, and I'm going to palpate your radial pulses here. All right, those are equal, strong. That's wonderful. Any problems with any of that?
No, do you want me to squeeze
Yep.
your hands?
Squeeze, give my hands a good squeeze, thank you. And so next I'm just going to take a listen to your heart and lung sounds, okay?
Okay, sounds good.
So when I listen to your heart, I'm going to listen first with the diaphragm of my stethoscope, which will just allow me to hear your heart sounds. I'm going to start at the aortic and then move to the pulmonic, and at both of those points, the S2 sound should be greater than S1. Then I'll go to Erb's point, where the sound should be equal, and then I'll do tricuspid and mitral, where S1 should sound greater than S2, okay?
Okay.
All right, so I'm just going to do it here. Okay, great. So now I'm just gonna listen to your carotid arteries on either side of your neck, okay? With the bell of my stethoscope. Great, and then so I'm just gonna have you lean forward a little bit for me. I'm gonna find your apical pulse. And then I'm just gonna feel your carotid arteries at the same time. All right, and then I'm gonna listen, have you keep leaning forward, and I'm gonna listen at all of the points that I just listened to with the diaphragm, okay? Yeah. All right, so I didn't have any evidence of murmur there. Your heart sound good. So moving on, I'm just going to listen to your lung sounds, okay? I'm going back to the diaphragm on my stethoscope. I'm going to do 6 points on the front, 2 on each side, and then 8 on the back, okay?
Okay.
All right, so every time I move my stethoscope, I'm just going to have you take a good breath for me, okay?
Okay.
Okay, great. And if you don't mind turning just to face that wall so that I can continue filming for quality assurance and training purposes. Perfect. No adventitious sounds. Your lung sounds are bilaterally equal and strong. So just do one more good breath for me. Chest expansion is equal and good. And I'm just going to pound on your back twice, and then you tell me if you feel any pain or tenderness, okay?
Okay.
How was that?
Okay.
Great. Just testing for CVA tenderness. So you can spin back around and face that way. And I'm just going to have you lay back on the table, all right? Perfect. And do you mind if I lift your shirt so I can take a look and a listen on your abdomen? All right, first I'm just going to look from here to make sure you don't have any thrills, lifts, or palpitations. And you don't, so that's great. First I'm just going to listen to your abdomen in all 4 quadrants, okay? Sounds are active in all 4 quadrants, and I'm just going to palpate, so tell me if you feel any pain or tenderness, okay? All good?
All good.
And how have your bowel movements been recently? Regular?
Very regular.
Perfect. No problems that you've experienced with those?
Nope.
All right, and how about urination? Any pain, burning, frequency, urgency?
Nope, all normal.
Sounds good. Okay, so now I'm going to listen to your abdominal arteries, okay? I'm going to listen with the bell of my stethoscope, and I'm going to start with your aortic, your renal, your femoral. All right, no sign of brewy there, so that's all good. And your skin on your abdomen is clean, dry, intact, no lesions, no redness.
Attention, cold gray, 4 southeast, cold gray, 4 southeast.
Color appropriate for ethnicity. What? We don't need to respond to that code gray. Everything's fine. So I'm just gonna move on to your legs now, okay? Just uncross your ankles for me. And then any pain, tenderness, numbness, tingling? Nope. Okay, that's good. If you don't mind just pressing against my hands and then pulling back against them. Great. The skin on your legs is clean, dry, intact. Again, no lesions, no redness. Do you mind just taking your shoes off for me? I just need to check the capillary refill.
It's a lot of work for.
Gotta make sure that you're all clear.
Okay, great.
I'll check the cap refill on this one while we do that.
Sorry, my toes are weird.
Less than 3 seconds. Everything's fine. Oh, fine.
Right, my toes are
Good.
weird.
Oh, perfect. And then I'm just gonna palpate for your pedal pulse here. Alright, that feels good. Okay, those pulses are strong, they're equal, and they feel good. So I'm gonna check your reflexes. I didn't bring a hammer with me today, so I'm just gonna use the stethoscope. I'm gonna palpate right below your kneecap here, your patella. Great.
Whoa.
Excellent reflexes. Okay.
Had a lot of coffee.
Fantastic. So I think that just about wraps it up for me. Do you have any questions for me before I go?
No, that was great.
Well, it was great to meet you, Georgie.
Thank you so much, Sage.
Have a good one.